Novaclinical, a brand of the Novavision Group, is an all-Italian company which has been a leader for over 30 years in the research and use of materials and the development of new technologies. This approach perfectly matches the unique style, design, beauty and quality that characterizes our country. We power our facilities with alternative energy sources and use renewable or recycled materials for all our equipment. This is because we believe that true innovation must also be integrated with environmental sustainability. Every phase of research, development, design and production takes place in-house. Expert staff, flanked by an ethics committee made up of doctors, engineers and specialists, dedicate themselves daily to the study and creation of new high-performance technologies and to the constant improvement of existing ones. Novaclinical offers a series of certified theoretical and practical courses to their own partners and practitioners. All of our divisions work constantly to exceed our clients' expectations. This is who we are. During a woman's lifetime, the tissue of her vulva and vagina, commonly referred as the inner and outer parts of the genital organ, may suffer varying degrees of damage and pathological changes. These may be related, for example, to the number and frequency of vaginal childbirths, the quality of labor, as complicated or overstressed childbearing can cause structural damage to the vulva and the vagina, and we mustn't forget the menopause. Today, the number of menopausal women in society is continually increasing, and the reduction of the hormone production creates a condition defined as genitourinary syndrome of menopause, resulting in degradation of the vulva and vaginal tissue and increased dryness and atrophy, thus complicating sexual activity and satisfaction. Novaclinical developed EVA, Enhancer of Vaginal Anatomy, that is today the most innovative, effective and advanced medical solution for feminine intimate care. EVA is an unprecedented technology with unique features and benefits that acts on the laxity of the vaginal introitus following vaginal delivery and aging, the most effective symptoms of the genitourinary syndrome of menopause, external vulvar rejuvenation, and mild SUI, stress urinary incontinence, as published by Drs. Vicariotto and Raichi in the June 2016 edition of the scientific journal Minerva Ginecologica. Novaclinical R&D division, together with 3 Italian universities and our scientific committee, improved the well-known dynamic quadrupolar non-ablative radio 4 technology in order to develop the new vaginal dynamic radio frequency, the core of EVA. VDR is based on the dynamic quadrupolar energy emission that automatically configures a group of 4 electrodes to enable the creation of buffering electrical fields which focus the action on the targeted layer of vaginal tissue, leaving the surrounding ones unaltered. EVA also features the patented radio frequency safety system. The tips are equipped with 4 special electrodes that constantly monitor temperature progression in 4 different places at the same time. In this way, the system is able to achieve optimal thermal stimulation of the tissue. The handpiece features a movement sensor system to ensure that the operator performs the correct treatment following the most effective and safest procedure. EVA technologies allow the treatment of the most annoying vaginal pathologies and conditions in a safe, comfortable, and effective way. In a very high percentage of menopausal and postmenopausal women, and because of reduced hormone intake, a very specific damage occurs in the vaginal epithelium, causing atrophy and dryness. EVA, acting by selectively warming the vaginal mucous membrane, creates a reactivation of microcirculation and a more nourished and hydrated epithelium, thus simulating the conditions of a young, well hormonally irrigated vagina. EVA improves vaginal structure and reduces atrophy, helping resume a normal and healthy functionality. Vaginal childbirth, especially if repeated over a short period of time or performed by older women or during complicated labor, has several effects on vaginal tissue that prevent the organ from recovering its elasticity and natural overall well-being. This series of symptoms have a negative repercussion on the patient's intimate life. EVA creates selective warming of the vaginal tissue, significantly improving the metabolism of the fibroblasts which are responsible for the production of new collagen, brown substance, glucosaminoglycans, and hyaluronic acid. The ultimate result is the reduction of the vaginal introitus caliber and a more compact and elastic tissue, this with no discomfort whatsoever to the patient and in a short period of time.
Senza recare alcun fastidio alla paziente.
Vulva pain is a matter of extreme importance because it concerns every stage of a woman's life, from puberty to post-menopause. In this case, the discomfort is not only a perceived sensation of pain, but may affect daily basic activities like sexual intercourse. In today's world, we have several options to invert this process, and among them is radiofrequency. At a vestibular level, we find two main reactions. First, it increases vascularization. Secondly, there's a regenerative effect, inducing new formation of collagen that in turn produces a double improvement, restoring trophism of the organ by nourishing and solving this lack of substances, and increasing the number of dermal appendices, creating a sort of regeneration of the nervous terminals. There are two conditions in which we may use this new methodology. Post-menopausal atrophy, where the subject may have a more awakened perception of pain, and some pain-related conditions in fertile women, defined as vulvodynia, that present themselves for a variety of reasons. For instance, the inappropriate absorption of hormone-based substances and/or autologous irregular production, or the over or under assimilation of estrogens. In any case, these symptoms increase vulnerability to pain, both with external touch and penetration during sexual intercourse. The gold standard of these techniques, radiofrequency being one of them, includes the absence of side effects, offering high compliance among patients, therefore reducing the use of topical solutions and maximizing their effect. The physiological processes of tissue aging and the occurrence of possible traumatic events such as complicated labor, for instance childbearing with deep episiotomy, can lead to certain modifications of the vulva that may cause a functional and aesthetic discomfort. Until today, the therapeutic options for treatment consisted of the injection of skin fillers directly into the labia majora, absorbable PDO lifting threads, autologous fat injections, also known as lipofilling, and platelet-rich plasma therapy, or PRP. There's also a more radical approach, such as the reshaping of the lips, both large and small, through surgical labiaplasty, and vaginal reconstruction through the use of several polymers. Today, we have the possibility to improve vulvar condition and the overall trophism of the tissue, while regaining aesthetic balance through the selective heat stimulation produced by EVA. EVA is a quadrupolar dynamic radiofrequency that allows accurate targeting of the selected tissue layer, comfortably improving microcirculation, stimulating the autologous creation of collagen and hyaluronic acid, and thus naturally restructuring the general aspect of the area in a long-lasting manner.